sir, is role of AI, artificial intelligence in otorhinolaryngology.
I'm ready, sir. Yes, please go ahead. Should go ahead? Okay. Thank you very much. Good afternoon, everybody. From that basic otological topic we are moving on to something advanced topic, which is gradually taking over the healthcare industry or health aspects of the world. That is artificial intelligence and machine learning. I see that still few members are yet to enter. It is really not quantity of the audience that matters. It's the quality of the audience that matters. You have some luminaries sitting in front of, in the front chairs, and that gives me a big kick. Thank you very much, sir. How many here, okay, all this presentation, whatever I do, I dedicate that to the universities, institutes where I learned. That's one is MIT, USA, as well as University of Science, and also our startup, that Karnataka Innovative MedTech startup. How many here believe that is one day this artificial intelligence will take away all the doctor's job? Please raise your hands. But still, you are a minority. You should have belief in the human ingenuity and authenticity. That nobody can beat, not even specifically machines, the human intelligence. I challenge today. But I'll tell you, let me put one sentence. The artificial intelligence may not take off the doctor's jobs. But the doctors who are trained in artificial intelligence and machine learning, they will take away the jobs of the doctors who are not trained. That means slowly, gradually, we all have to get trained into this. But that is really not a rocket science and rocket technology. There are so many now commercial websites or commercial entities are there which we can use with minimum limited knowledge. I will come to that, whatever it is. Recently, there was a summit in UK. Everybody said the artificial intelligence is not safe. We declare that AI poses a potential catastrophic risk to humankind. But each and every company, every country thought that, and I cannot wait to develop IT first. Everybody is developing IT first. And our minister, Mr. Piyush Goyal, he said, India can become the talent capital of the world with artificial intelligence. Let me tell you, 95% of the engineers who are working for AI across the world are Indians. So AI is being developed by Indians, not anybody else. Let me state that. But AI gives a lot of power. At the same time, we should remember that with great power comes with great responsibility. That is very important. And now, what is AI? Let us go back to learning AI. Let us go back to the basics of how we started our kindergarten school. How many will tell you? A stands for? The moment they see the picture, the apple that name is in mind. Isn't it? Human mind is so fast. Just glimpse you had long back. But if I want to train the artificial intelligence, the computer, same thing, I will add to, upload all the apple pictures and tell it repeatedly, it is apple, it is apple, it is apple, it is apple repeatedly. Then it will be able to tell it is apple, indeed it is apple after a long time. Next. What is this? Hey, be specific. Somebody said basketball. Arey, chocolate de do yaar. So, again to say this, AI will take long time. You'll have to feed all kind of balls. Then you have to repeatedly tell, this is basketball, basketball, basketball. It will tell you basketball. Maybe after a day. Okay, next. There are different pictures. But still there are cats only. That we would know easily, isn't it? Even hearing the voice, noise, you can say, "Yore yak billi kai pe pooch raha hai." Billi. So, but if you feed all these pictures, the AI may not recognize unless you say each and every of them is a cat. So that complicated it is. So now coming to how AI/ML works, it is what we do is we feed the machine. First, we feed the normal pictures. This is normal CT scan, normal, with various anatomical variation. Lelo yaar, this is normal, this is normal, this is normal, this is normal, this is normal. Then what we are going to do is we put the abnormal CT scans or images or whatever. Yeah, abnormal, cholesteatoma. So feed all these numerous thousands of pictures. One or two is not enough to train the AI. You need lot of this thing. So what it does next is, it will put that, it will do a statistical analysis what was normal, red, and what was abnormal, light green. Then it will merge and it will analyze, okay, this green, this is some pathology, that will tell us this is some pathology. But as you train, it can tell you faster than in our minds, our radiologists or whatever. That is the advantage of AI. So suppose you have a decision tree, big decision tree like this. How to make a decision? You have to examine each and every parameter. Say this is a difficult airway, pediatric difficult airway management algorithm. It takes quite long time. Once you have trained the data to AI, you put the basic parameters, this decision AI will make and that will save your time. This decision tree becomes very useful. Okay, that is where the advantage of AI. So how does AI work? How are these computers working? They're like our neural minds. You can say that the network, the AI network is like a brain only. In the similar way, this is nothing but a network of computers, advanced computers, and each computer is designated to do a specific work. Say, I showed that decision tree. Each system is trying to do a specific job based on this network, specific job, and that will give the results. Okay, this is we call neural network, NNs. Okay, this is how it gives results. So what actually it involves is you feed the data, then AI develops, it analyzes the data, do the data analysis, okay, and it will go through the regulatory approval also, what the government says, whether it can be used or not, then you can apply clinical or operation value. That is exactly what AI does is, okay. So basically, if you want to be AI specialist, you need to be a data scientist. We learned all these calculations during PSM. Hope you remember. We remembered all calculating mean and all, and if you are in the habit of writing papers regularly, you do this data analysis regularly, or you give it to a statistician. But if we want to become AI engineers, we need to master this. We have to become a data scientist. We should know each and every parameter, how to analyze this thing, what exactly is required, and based on that, it gives. So basically, if you are a AI scientist, AI technician, or AI specialist means you are a data scientist. And what kind of computers we need for this? We need computers with graphic interface units, GPUs. That's why nowadays, earlier Intel was on top. Now the NVIDIA has gone on top because NVIDIA used to produce the graphic chips. For AI to work, it is a graphic chip, something like 24-core CPU and 76-core graphic PU, having about up to 128 of unified memory with a lot of capacity. And see, one such laptop costs about 12 lakh rupees. So that means it's also expensive. At the same time, it consumes a lot of power. That is a drawback. But human mind, अरे एक चाय पिला दे मेरे को आइडिया आ जाता है दिमाग में है ना this thing. So how AI is helping now, we can use it. I'm going to quickly pass through this, how AI can help our humanity, and we doctors are otolaryngologists in AI and ML. The first in otolaryngology, the first thing is in the diagnosis and imaging, that it can help in imaging. It can use a lot of images, what we feed from, say, CA oropharynx, where a lot of interest is there. You feed those pictures, clinical pictures, and the CT or MRI pictures, images, then it will analyze and give you a quick result whether this is cancer or not based on these images. Next, what we can do, predictive analytics and personalized treatment. Individual needs individual treatment. AI can help with that. And for example, OSA treatment, it can analyze the algorithm and tell you. And the second is voice and speech disorders. Like we feed the images, we can feed the voices also. It will convert into spectrograph images like this, analyze, and I'll give you what exactly the diagnosis. So many analyses are there. Next, what it can do, surgical assistance and robotics. Robotics is the new thing. AI can help in a big way. Recently, from Saudi Arabia, there was a big news that AI-assisted robotics, it did a heart transplant or something. Okay, that's how. Now, cochlear implantation is also being done using AI. So that's how AI helps. The next is hearing aid and CI optimization, cochlear implant optimization. I'm going to talk to you about little detail, what work we are doing. It can help in a big way. I'll skip these slides. And also sleep medicine and OSS management, obstetric sleep apnea management, it helps in big way. Okay, artificial neural networks, and also patient monitoring and remote care. Now, this is the thing to reduce the cost. Patient can be monitored. He can be at his home with all the wearables having, and all the controls are being shown to your screen at your home or to your office, your clinic, and you can monitor the patients. And it will alert, AI will alert whenever patient needs some intervention immediately. Okay? And all these healthcare trackers using various sensors that can help, and also research and drug development. Now, any new drug to be developed, it takes about 12 to 15 years, including regulatory clearances. But with AI/ML, we can detect a new drug in about 2 months, and it can bypass many stages. And education and training also, we are working personally a lot in this. If you visit for any hands-on training programs from after 6 months, our institute, you are going to learn something like this. We are trying to develop this virtual reality, artificial reality like this. We can train a group of, the students or trainees like this. This is going to be the future of the training, and we can give complete virtual reality with whatever. We are trying to develop a virtual temporal bone dissection like this. Yeah, okay. And this is going to be the future of future training. Okay. See, look at our now, if a doctor wants to be a specialist who is joining today, okay, he takes next 10 years means, I'll tell you, the technology concerned in next 10 years is going to change the whole thing. The doctor may not have work at all. That's the kind of fast innovation is going on. And also, what work we have done is, one is the precision, in the speech processing, we have done some work. I'm going to share with you. This is our work. You know that cochlear implant is the thing now for severe to profound hearing loss, and now it has also expanded indications and outcomes. However, outcomes are variables. A lot of variables are there which determine the outcomes of cochlear implant. There are more than dozen variables are there which determine the outcomes of the cochlear implant. And how AI can help in cochlear implantation to enhance the productivity of the cochlear implant is, at least, see, there is 6 stages of cochlear implantation, starting from pre-op evaluation, counseling, surgery, device activation, mapping, and rehabilitation. And AI can help in outcome predictions in vestibular cochlear anomalies, and prediction with ECAPs, personalized mapping, speech and sound processing, and also noise reduction, and prediction of surgical difficulty based on images, and data analysis. All this AI can do it. And we have done a study, okay, prospective study based on this. And what we have done is, we are studying 4 parameters, that is outcomes in vestibular cochlear anomalies using ECAPs, and also in speech and sound processing and surgical difficulty, what we are doing. And also, first study is on the speech, this thing. See, AVT in India is a challenging, you know that. One is, variation in the languages. There are different languages. Each language has different dialects. Okay, and also there are limited AVT facilities in India unless patient is in a metro, in a center, attached to a center. Okay, that outcomes are always challenging because of that. So what we have done is, we have introduced a novel solution tailored to speech processing, with a tailored speech processing approach. We have used narrowband signals and fundamental frequencies. We have integrated artificial intelligence and machine learning into it, and also we have exploited conventional methods of speech processing. So, see this, when we went to the companies, they didn't allow us to touch their processor because they don't want to, there are a lot of secrets inside, and they are also suspicious about what are we trying to do. So we developed a standalone device with AML strategy using recurrent neural networks. This whatever standalone equipment is there, this can be connected to the patient's processor, cochlear implant processor, either through Bluetooth or wired connection or wireless connections. So what it does is, how we started was, we collected a lot of data, the speech data from a prospective cochlear implant patient. We collect the speech data from his home surroundings for more than 6 months to a year. We fed that and used that model to train this AI model. So how it works, I'm going to show you this thing. Bhaiya, sound hai na?
Twinkle,
Listen to
twinkle,
this.
little star, how I wonder what you are. Up above the world so high, like a diamond in the sky.
Twinkle, twinkle, little star, how I wonder what you are. Up above the world so high, like a diamond in the sky.
Twinkle, twinkle, little star, how I wonder what you are. Up above the world so high, like a diamond in the sky.
Twinkle, twinkle, little star. How I wonder what you are. up above the world so high, like a diamond in the sky.
These are the different variations what is present to the patient. So when a cochlear implantee, when he has challenges to understand all this, what does our application does is, it will convert everything to one uniform
Twinkle, twinkle, little star,
signal.
how I wonder what you are. Up above the world so high, like a diamond in the sky.
Irrespective whatever, whoever speaks in whichever way, this is what it presents to the patients. So the patient doesn't have to be burdened with
Twinkle,
different...
twinkle, little
Twinkle.
star.
Twinkle,
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 little
little
star,
star,
how I wonder what you
how
are.
I wonder.
Sorry. So what we did, we validated these algorithms using robust tools, that is electrodogram, that individual electrodes we analyzed of the cochlear implant and also different AML patterns. See, this is the study we did, patients without such algorithm and with algorithm. The blue one is without algorithm, the red one is with algorithm. With all, we did all this study, CAP, CAD, HINT and CNC, all these tests, and we found that this really helps compared to the conventional ones. And we had a p-value of, with the statistical analysis, we had a p-value of 0.0497, and it was statistically significant also. And most importantly, what we realized is, with this algorithm, there is augmented music appreciation. These, some of these patients were postlingual, and they had listened to these songs earlier, and when we played these songs, they could identify the songs easily. They said, this was the song sung by so-and-so person, and they could hum that song also. And all patients refused, AVT after 2 sittings. This is not necessary. We can hear the conversation very easily. This is one of the signature case.
ఇంకొకసారి చెప్తాను విను కల్లు మన్ను తాయి తందే గంటు మూటే అంద చంద అత్త ఇత్త సుత్త ముత్త మనే మట ఒల గద్దె బెట్ట గుడ్డ.
Yeah, this is after 1 month after activation. That patient refused after that, he said, I don't need any AVT. He said, I'm hearing good enough. But we find such results in postlingual patients. But I've compared with the existing analog algorithms also. Compared to those patients, these patients are definitely doing better. But only limitation we have is, need an additional pocket model device right now, because the existing companies, we are unable to negotiate with them to integrate this yet. Rather, we avoided them for time being. And also this software can be installed on existing softwares, because we want to make it an open source. But these companies have to, enhance the processing power of this software. Anyway, so far, this is limited to 4 South Indian languages. This is a pilot study. We have to make more study. The another thing we have worked on is, that is vestibulocochlear anomalies using images. I will skip this. The existing, what they are doing is to say, like, whether there's a good result in such in some cochlear vestibular anomalies. We basically use audiological data and imaging, okay? And we do a anatomical based classification and find out surgical difficulty, and also functional evaluation. We do this, and this is our AML model. I will not go into the techniques of this. And what it does is, it will stepwise analyze the MRI of the temporal bone, okay, from inside to outside. And also it will analyze the CT scans and audiological data. And when we feed this, it does the statistical analysis and provides a heat map like this. That means, irrespective of whatever the anatomical variation in the temporal bone, it will give a heat map like this. The green means is a good case for CI. You can go ahead and do it. The red means it's a contraindication for CI. You go for, patient will have to go for alternate, that is auditory brain stem implant. And some cases like cochlear nerve hyperplasia, if it gives orange, can be tried EI kind of thing. Okay, this is what EI does. Okay, so we compared our data with international studies in such patients, and we found that this is comparable to the existing benchmarks. Okay, whatever is being done. So anyway, so far the number of studies, number of patients are less, because we don't have access to other cases, whatever cases we have this thing. So our AML, it could measure the accuracy up to 92% with sensitivity of 95% and specificity of 75%. Okay, that is one thing. So definitely, provides more superior accuracy for individual outcomes. That's one thing. But there are still challenges and limitations we would like to overcome. And I will skip this. Other thing we are working on, ECAPs in cochlear implant patients. The role of ECAPs is very well known. Okay, that is electrically stimulated compound action potentials. But instead of ECAP, we are using eBERA. That is, you stimulate the cochlear implant after implantation, and you do the BERA test. That will provide, ECAPs provides only the compound action potential of the cochlear nerve, whereas BERA provides entire the auditory pathway. So we are measuring BERA. So we do the BERA recording after stimulation. And with this also now, we have found good results to start with. We don't have big numbers yet because we have just started. I'm definitely in future, as we go more and more cases, we'll get more experience. And all this data, we are trying to put it as an open source on our company as well as hospital website will be available for all of us to use it, because any technology which comes, it has to be democratized and made available to the people. That's what I believe. That's only when the science grows is when you democratize it. That's when the acceptability also increases among the people. Yeah, thank you. Thank you very much, sir.
That was fascinating insight, Dr. Prahlad. Thank you so much. Are we taking questions?
Yeah, if any questions, I'm happy to answer this, sir.
Thank you, Dr. Prahlad.
Yeah.
Thanks.
Thank you, sir. Now I request our chairpersons to felicitate Dr. Prahlad, sir.